Okay, this session is to help those of you who've got a sore lower back first thing in the morning when you go into flexion. So if you're getting out of bed and you're bending forward like you're sitting on the edge of the bed and you go into this position here, this flexion position, or whether you sit on a seat in the morning for breakfast and you go into that position and that is really sore and tight, then this one's for you. Now this is not for a lumbar disc problem. So it's not an acute lumbar disc problem where you can't bend backwards. This is for people who can fully bend backwards, no problems. And they're not too bad going forward here, but they're really tight in the hemis and really tight in the lower back. Super common for people who have been standing all day or going for a long run or just being on their feet for most of the day. And usually those people have got a bit of an anterior tilt and the abdominals are a bit lax and protrude like that. Now if that's familiar to you, where you're a bit sort of loose here and too tight here, then I've got the stretches for you to do before you can get in all the abdominal work. So this is first thing in the morning. When you, like I said, when you're sitting or you get in the bed and you're going, oh, that's really tight going to that direction, but it's okay into extension, this is what I want you to do. First thing you're going to do is not try and go into flexion because it's too tight. So you've got to look at the components, which is your hamstrings, glutes, then you go into the flexion stuff and then get the lower back muscles released last. Once you've done all those four things, then you're ready to work on your core and other flexibility, which is probably the cause of the problem. Most of the time it's a lack of abdominal strength in the front, but hey, we want to work on the acute stuff when you're stiff and tight so you can actually get to that later on. That's another video. This thing I'd work on is try and go for your glutes. Now this is best done when you're lying down, all right? And because you can't really go into flexion, you can't really do this one. Most people find that's too tight. Okay, they might be too tight in their glute and too tight in their lower back to actually flex, so they can't even get to that point. So all you do is find a wall for this and keep your back in neutral. So number one is working on trying to release your glutes by putting your foot on the wall, up into there and down. Now you just need to work away from the wall enough where you can keep your back in neutral here, all right? Then you'll get a glute stretch here. Now that's designed to try and release off the buttock part, which will help you bend forward. That's the first component we work on. Don't work on the back component, work on the hip component, then you'll find it easier to work on the back. Tip with this is, if you start in neutral, and what you could do is put your hands around under your back to keep you neutral, if you like. What you can do while you're stretching this out, once it starts releasing, then you can start thinking about getting your back down into the ground. Now that will take off the pressure on the glute. So you'll find that if you keep your back arched, you get more stretch here. If you keep it like that, then you'll get less stretch. But we're aiming to try and get the back looser. Okay, so I don't mind if you start off with a stretch arched, and then as you loosen up in the lower back, you can slowly let that back sort of imprint into the ground and posterior tilt that way, okay, to get a bit of stretch on there. But make sure you do both sides, okay? One side's probably going to be tighter than the other, so you might have to just position yourself to the point where you get a stretch, the same stretch on both, okay? And I'd work on a minute each side. Get that done first, all right? Then you'll probably find when you get back to here and you go back to the sitting spot, you go, actually that's a little bit better, all right? So you're on that road to getting it better. Next thing, work on your hamstring. Like I said, another component. We're working on posterior chain stuff for the lower back because it's posterior. So work on the glutes, then the hammies. For hammies, what I would do, same sort of concept. If you go for a hamstring stretch like this, sitting down is pretty quite easy because you're on the edge of the bed again. Keep the knee bent, right? If you have it straight, it's too much tension through the whole chain, so keep it bent. What you do is you go and arch your lower back again. Remember, you don't like going into flexion at this stage in the morning, so you keep it arched. That will also give you more hamstring, okay? You'll find if you round, you lose the hamstring stretch, so keep it arched. Then you reach forward down your shin. Go to the point where you feel that hamstring tension there, okay? So you go, okay, now I can feel that hamstring stretch here, not a back of the knee, calf sort of nerve tightness. You want to work on the hamstring. Sit there, same drill, sit there for a minute. making sure your back, if you look at my back here, I'm trying to arch it. So think of like, lift your lower back, lift your chest to keep that stretch on down here, all right? Don't fall into the trap of rounding your upper body and go, why can't I feel my hamstring? You need to keep your upper body upright like that. Now, same drill like I said with the glute. Once you find that you're getting a good stretch here, then you may find you can actually creep into a little bit of flexion for the back. Okay, so you're slowly stretching out. You're not doing a full stretch on the lower back, just a little bit from neutral to rounded. You can see if I go from here, from straight, I'm going to drop it a little bit and just go to the point before it gets sore. So you're trying to slowly stretch that lower back out. It takes a bit of time. You'll lose a little bit of hamstring stretch, but that's okay because you've already stretched it out. Then you can go into a little bit of flexion. So both the glute and the hammy are a little bit of a combination between going for the muscles, posterior chain in the leg, and then slowly creeping into the back. Because like I said before, it's too hard just to go and stretch it out. It's too sore, all right? So if you can creep in one side at a time, all right, so not two sides, one side at a time, you go from extension to flexion, you may find those little bits of movement help loosen you up, and then you're really getting there, okay? So once you've done those two, again, like I said, you'll probably find, okay, you sit again, you go, actually that's freeing up a bit more. It's still got a bit to go. So then you go into your two lumbar flexion ones. What I would do, the first one is completely unloaded, and that's your child's pose. Now most people go, oh yeah, child's pose, that's normal. A couple of tips with that though. When you go into child's pose, keep your knees wide because your bum's sort of going to go down between your heels a little bit. Now it does depend on how much range people with their knees have got, but what I want you trying to do is to have your hands forward so you actually stretch out all the tissue from your lower back upwards, and you're going to sit your bum slowly down. You go to the point where you feel that lower back rounding and stretching out. I would just go to the point where you go, okay, that's a good stretch but not a painful one, and just wait there. Now you can see I'm quite high with this. I'm not down in a full child's pose because at this point most people's backs you feel the tightness there. It's nicely unloaded, so you don't have any compression down. You're just stretching muscle tissue out and ligament tissue out the back of that lower back, and you just get in there and see if you can stay in there for a minute. Okay, so I do 3 of those, all right, one after the other, have a little break in between. Each one you'll probably find you get lower, lower, lower. The idea is to go from perhaps a sort of semi-straight lower back to then try and fully round down and get this part here, your lower back, rounded out here to the point of what you can handle. Okay, so 3 of those, you'll go back to your sitting again, and you go, okay, now we're loosening up a bit more, all right? So once you've got the movement back a little bit more like that, then you can go into a QL stretch. But most of you, the full QL stretch like this, where you're on the ground, is just far too much. You can't even sort of like, people can't even get into that position when they're so tight. So do the modified version. So the modified version is jacking yourself back up on something like a box, a sofa, a chair even the edge of your bed, all right? So you don't have to worry about the hip, okay? Most people's hips are so tight they can't get into that QL stretch. So if I'm gonna stretch out my left hand side, okay, I wanna put that leg just relaxed and my right leg out, okay? So it's the opposite leg out to what side of the lower back you're stretching. From there, I want to position my knee, because I've stretched my hammy out, my glute out, I've got a lower back, I should be able to reach forward and grab that foot now, okay? Now I'm just doing one side. If I try to do 2, it's too hard. So this is why we do one side at a time. So have that leg relaxed, then I don't worry about my hip. Reach slowly down and just grab the foot. Now this hand here, you keep it on your thigh because you need that as a bit of anchor. I want you to, for your left side of your lower back, rotate left as far as you can go. Now you're going to start feeling that around the obliques, into that QL, and then we're aiming for those extensors as well. All right. Sometimes people might feel a little bit in the hip as well, but you're trying to keep this hand here to push back on, so it can sort of rotate back. Go as far as you can, rotation to the left. Okay. Then, if I look at my right hand, I'm going to use my right arm and I'm going to pull myself with my right arm. See that? I'm now side bending directly over to my right side. The more I side bend, the more I'm going to load up here and stretch that out. But I've got to keep this hand here to keep rotated. Most people will go forward and then drop in and then lose the stretch. So the trick is keep rotated then side bend and go as far as you can. Again, 1 minute holds, try and do 3 of those each side. I would alternate between the two. So you go, okay, there's 1, make sure it's okay, go into the other side. So for my right side of my lower back, I'm gonna have my left knee bent. That's just relaxed out there. Creep forward, slowly grab the foot. Can you see, imagine if I tried to do this one first? Like that would just be too hard. Like I haven't got enough range. But because I've done those other 3, I can now go, hey, I can actually get there to start the stretch. I'm still tight, but at least I can start doing it. Then I push around, turn around the opposite way to the right, and then use this left arm to pull myself and side bend over to the left, which stretches out the right hand side. Okay, so that's your modified version of our famous QL stretch. So once you've done those 4, you're more likely to, when you sit, go, okay, that's freed up quite a bit. It's not going to be perfect, but the idea is to loosen you up enough to get you moving to then you go, okay, I'm functioning, I can have a breakfast, where I go, then go through some deeper stretches and most likely your core work, which is probably the problem in the first place. Like I said, people who get lower back stiffness and pain in the morning from standing all day or running is usually because, 1, they're quite tight in the hamstrings. Most people are like that. You'll find that they can't get any further than that. All right, so that's number 1. Number 2, they're usually in a bit of an anterior tilt. They run and their abdominals, which is the biggest cause, are distended. Okay, so they're out like this. All right, and that's no support for your lower back. So if I'm relaxed here and doing nothing instead of being on and switched on, my lower back does all the work when I run and stand. That's why it's so damn tight. So don't forget, this is for people like that. It's not for people who've got disc problems. These people usually have full extension. So I hope that helps you first thing in the morning. Remember, you've also got to work on abdominal strength and posterior chain flexibility. See you next time.